everyone for joining us. We're just going to give Zoom a few seconds to add everybody, and then we will get started. Okay, hopefully everybody has been able to join the call now, so we will go ahead and get started. Thank you everyone for joining us. Welcome to the latest Duke media briefing on the COVID-19 pandemic and its effects on society. I'm Greg Phillips with Duke Communications, and I'll be moderating this panel. Before we start, I'd like to acknowledge the Shutdown STEM and Shutdown Academia events that are taking place at Duke and across the country today in support of the Black Lives Matter movement. Duke supports these actions, and we're proceeding with today's briefing only because we're sharing essential medical information during a public health emergency. We have 3 Duke scholars with us today to discuss the disproportionate effect the pandemic is having on Spanish-speaking communities here in North Carolina and across the US. I'll introduce our speakers and get the discussion started, and then we'll open it up to questions. We are recording this briefing, and that recording will be sent to everyone who registered. We have a mix of English and Spanish language media outlets joining us today, so our scholars will give their opening answers in both Spanish and English. Thanks to those reporters who already submitted questions in advance. During the discussion, I encourage those of you joining us on Zoom to submit questions via the Q&A window as they come up, and there will also be an opportunity to ask questions out loud in a few minutes. So now I'd like to introduce our panel. With us today is Dr. Viviana Martinez-Bianchi. She is a primary care doctor at Duke Family Medicine, where she is also Director of Health Equity and an Associate Professor in Family Medicine and Community Health at the Duke University School of Medicine. We also have with us Professor Rosa Gonzalez-Guarda, who is an Associate Professor at Duke School of Nursing and Co-Director of the Community Engagement Core for Duke's Clinical Translational Science Institute. And finally, Dr. Gabriela Maradiaga is an Assistant Professor of Pediatrics at Duke. She's a Fellow at the American Academy of Pediatrics, and with Dr. Martinez-Bianchi, co-leads Duke's LatinX advocacy team and interdisciplinary network for COVID-19. Okay, Dr. Martinez-Bianchi, I'd like to start with you. The numbers show the pandemic is disproportionately affecting the Latinx population in North Carolina and across the US. What are some of the factors driving that disparity?
Yeah, thank you for a very good question. You know, epidemiologists and demographers are going to have more information as time evolves. But one of the situations that we are looking at is that the Latinx community all over the country have often been essential workers. And we're talking about people who have during this pandemic, be essential working in meat packing plants and manufacturing. They have been involved in cleaning, maintenance, construction jobs. So while the rest of the country did quarantine or was able to stay at home to flatten that curve that we were trying to do, the Latinx community continued to go to work. So what we're seeing is that now all these people who have been essential workers, who worked without giving the PPE, the masking and the protection that was likely required during the time of their jobs, are now becoming affected by the virus. Lo puedo decir en español. Estamos hablando de que mucha de la población latina dentro de este país son trabajadores esenciales. En gran parte trabajadores que son los trabajadores esenciales que mantienen la economía tanto del país como del estado de Carolina del Norte. Gente que no pudo mantenerse aislado en la casa durante el tiempo en que muchos otros grupos pudieron sí aislarse, que siguieron yendo al trabajo, en donde no utilizaron máscaras, gente que trabajó en las plantas de faenamiento de carnes, gente que trabajó y trabaja en la construcción, en limpieza y en otros espacios en donde no han tenido las precauciones necesarias y donde no pudieron protegerse de la transmisión del virus. Entonces, en este momento estamos viendo que el resto del país, gran parte de la gente ha podido hacer la curva plana que se buscaba con el aislamiento social, pero que en la comunidad latina la curva está aumentando casi desenfrenadamente, en particular en el estado de Carolina del Norte. Otra cuestión también con respecto a esta comunidad latina es la gente que vive en hogares multigeneracionales. Another portion of this is the amount of people who live in multi-generational homes, able to spread the virus from those who are working to their children and their parents and grandparents with whom they live. Thank you.
Excellent. Thank you so much for that. Professor Gonzalez-Guarda, I'd like to move on to you. How badly is the response to these communities' needs lacking so far? And I mean, what kind of other interventions are needed?
I would say that I think it's important to first start off by acknowledging that there's been incredible work done by many on this call today and many community-based organizations. But the point is that we need more. We need more investment of resources and attention from leaders in government, in healthcare institution, and business owners. As my colleague Viviana mentioned, the primary way that the Latinx community is becoming infected is simply by going to work. So if we think about prevention, I think it's important for us to do more around providing appropriate protections in the workplace. And this means not only providing masks and social distancing measures in the workplace, but also putting pressure on business owners to also provide paid sick leave to workers so that people don't have to make the decision between going to work and potentially, while they're sick, and potentially infecting others or paying rent or providing food at home. The other thing that's really important is to make testing accessible. Unfortunately, one of the barriers to testing in the Latinx community are issues around who's going to pay, access to insurance. So it's really important for us to think about how to overcome those issues related to insurance and payment, and also bring testing to the communities, and with testers being bilingual, bicultural, and people that are trusted by the community. And then lastly, I think it's very important for us to provide resources to the community to help them track symptoms if they're sick, and provide resources to people to provide them advice on when it's safe to stay home, and importantly, when it's important for them to seek care. Just to say it in Spanish, yo creo que al principio es importante decir que hay mucho trabajo bueno que está ocurriendo en la comunidad, pero sí necesitamos más recursos para prevenir y para abordar apoyo a la comunidad latina. Es importante que nosotros nos enfoquemos en el hecho de dar protecciones a empleadores que están trabajando, yendo de trabajo, protecciones en el trabajo, también incluyendo la habilidad de recibir pagos si uno está enfermo, para que las personas no tengan que decidir entre trabajar y tener la potencial de infectar a otros, o poder traer dinero y comida a la familia y pagar renta. Lo otro que es muy importante también es asegurarnos que las personas tengan acceso a hacerse la prueba de COVID-19, y para hacer eso tenemos que pensar en cómo podemos abordar y llegar la prueba a las personas que no tienen seguro. Y finalmente es importante nosotros enfocarnos también en dar apoyo a las personas para poder vigilar los síntomas de COVID-19 y dar consejo a las personas en cuándo es seguro mantenerse en la casa y cuándo es importante ir y buscar ayuda médica. Gracias.
Excellent. Thank you so very much. Dr. Maradiaga, I'd like to move on to you. It's been reported that children are generally less at risk of serious illness from COVID-19, but we're also seeing that some children have suffered very serious complications. Can you provide some perspective on how COVID-19 is affecting children in particular?
Yes, thank you. I think this is on everybody's mind because we all know a child somewhere, could be our own or a loved one, and the concern, of course, is very high. I think the perspective that's important to remember is that right now, overall, what we have seen is that COVID-19, while it does infect children, has not caused similar amounts of harm and mortality that other common illnesses like influenza do. So, for example, right now in the US, we have almost 2 million cases of COVID reported, but only about 70,000 of those have been children, which is about 3.5%. So out of every 100 cases, only about 3 of them are children. And these are fairly similar numbers to what have been reported in other countries like China. So about 2% infection rate. On top of that, it's important to highlight that the death rate reported so far in children is very low. As of last week, the CDC had only reported about 20 cases of deaths in children under the age of 15 by COVID. So while we are always on the alert and we want to protect our children, I would encourage everybody to remember that right now, the severity that we are seeing in children overall is very small. Entonces, lo que quiero hablar ahorita es sobre una perspectiva importante de los niños, porque todos tenemos a un niño que queremos y conocemos. Es importante reconocer que las tasas de enfermedad y mortalidad en los niños son bajas comparadas a otras enfermedades comunes en los niños, como la influenza. En Estados Unidos estamos acercándonos a 2 millones de casos de COVID-19. Pero los casos en los niños apenas llegan a los 70,000, es decir, de cada 100 personas positivas, solo 3 son niños. Y estas tasas son similares a las que hemos visto en otros países, como China y también en Italia. Entonces vemos que aunque muchos niños se enferman, no son tantos los casos como en otras enfermedades. También la severidad, la gravedad de lo que les pasa a los niños es menos. En todo el país hemos reportado 20 casos de niños muertos por COVID-19 menores de 15 años. Entonces son muy pocos los casos de los niños que han muerto y que están afectados. No quiere decir que no se enferman, solo que por el momento no estamos viendo tanta gravedad en los niños.
Excellent. Thank you, all panelists, for those opening responses. We'll now move on to the question portion. So if you are joining us on Zoom, you can submit a question through the Q&A window, or you can press the button to raise your hand and we can unmute you so you can ask a question. If you're joining us, if you're not joining us via Zoom, but joining us by cell phone, you can hit *9 to raise your hand so that we can unmute you. And when taking questions, our panelists have agreed to answer the question in the language in which it was asked and then provide a condensed version in the other language. We have some questions that have been previously submitted, so I'll start with those. And I just remind our panelists to identify yourself when you start speaking so everybody is clear who's joining us on audio, who is speaking. And actually, Dr. Martinez-Bianchi, we'll come back to you. Could you start by telling us a little bit about Duke's Pandemic Response Network and how that's working to help the Latinx community?
Sure. So voy a empezar en español. El Duke Pandemic Response Network es la vigilancia de salud comunitaria de la Universidad de Duke. Es un programa que es un programa aprobado de observación de síntomas que durante 28 días una persona que tiene ya sea el diagnóstico o el test o está preocupada por ese problema se registra durante esos 28 días y las personas y lo están ayudando a monitorear esos síntomas, ¿no? Entonces, ¿quién se puede inscribir? Cualquier persona que está preocupada por la exposición al COVID-19, aunque no los tenga los síntomas, y tiene una conexión que le ayudan a manejar con seguridad los síntomas relacionados con el COVID-19 en su casa. Le ayudan a seguir recomendaciones, le envían recordatorios de 2 veces por día, monitorear sus síntomas, para ayudar a caracterizar la progresión del COVID-19. Tengo pacientes que se han registrado en el Pandemic Resource Network y gracias a que están registrados les han avisado, uy señora, debería en este momento acercarse a hacerse ver en la clínica, ¿verdad? Es el momento de que en vez de estar solamente un monitoreo desde la casa, que es el momento de ir a la emergencia porque ha tenido empeoramiento de sus problemas de salud. Ahora en inglés, el Pandemic Response Network, managed by Duke, es it has the vision of empowering individuals and communities across the US to monitor medical and social needs related to the COVID response, to COVID-19. People register through this pandemic response and are given recordatory and ways to maintain and control what is happening with their symptoms. They get phone calls, they get a reminder, and they send twice daily for 28 days the symptoms that they are having. They have a follow-up by a team from the Pandemic Resource Network that follows them when they are hearing that the symptoms may be worse. I have patients registered with the Pandemic Resource Network who have received a phone call to please, given the symptomatology that they have at this point, it will be important to go on to an emergency room. So it's a really important way of symptom self-monitoring and management of the COVID symptoms.
Okay, excellent. Thank you very much for that response. We have a couple of hands raised, and so if we can, let's unmute Paula Jaramillo, and if you could go ahead, and if you have a question for a specific panelist, then please go ahead.
Gracias, thank you. Doctora Viviana y al panel, buenas tardes. Mi pregunta es la siguiente. Esta mañana atendimos a una charla donde estuvo la secretaria del Departamento de Salud y Servicios Sociales. Le preguntamos cuáles eran las acciones concretas que iba a tomar el gobierno estatal con respecto a tratar de disminuir la disparidad entre los latinos con COVID-19. Pero la respuesta es que no hay una política pública creada específicamente para la comunidad latina. Es más bien general, es lo que hemos hablado, lo que se le ha insistido a la comunidad en general. La pregunta es si el gobierno estatal no tiene claro cómo enfocar este problema con nuestra comunidad latina, con casos que ya van a llegar al 50%, ¿cómo vamos a poder disminuir esta disparidad si el gobierno local, el gobierno estatal, no tiene claridad para dónde va, no ha creado nada específicamente para nosotros? Quisiera conocer la opinión de ustedes al respecto. Gracias.
Sí, mi opinión es que el gobierno estatal está tratando de, por eso están conveniendo estas reuniones telefónicas para tener más información a través de desde la comunidad latina acerca de cómo debería hacerse. Uno de los casos que yo veo es que se ha tenido miedo, inclusive desde los departamentos de salud, que se estigmatice a la comunidad latina a través de esta respuesta, que por decir que tenemos que poner un énfasis en la comunidad latina, yo creo que ellos, con respeto a que no se haga un estigma, que no se haga una culpa del latino, han estado tratando de protegernos de alguna manera, y a la vez y al mismo tiempo es un problema porque es necesario proteger a través de la información. Entonces, lo que estamos haciendo desde el grupo LatinX y desde muchas otras organizaciones en todo el estado es pedirle al gobierno que necesitamos una forma de trabajar que realmente tenga un énfasis en la comunidad latina. El Estado está formando una task force muy importante. El Departamento de Health and Human Services, de Recursos Humanos y de Salud, ha formado unos grupos de trabajo en donde se está trabajando cómo hacer todo esto. De hecho, se habían hecho 250 traciadores de síntomas, de los contact tracers que se le llaman, y se volvieron ahora a buscar 50 personas más. Ya era un porcentaje de esos 250 eran de habla hispana, que hablaban español, y ahora se están buscando 50 personas más que hablan español, porque realmente hay que llegar a la comunidad latina buscando con gente que entienda cómo conversar con la familia latina acerca de esto. Entonces voy a contestar la pregunta ahora en inglés. The participant was asking, is is there and why isn't there a government response that is particular to the Latinx community? I think one of the observations that I can make is that health departments and government as well have been careful not to stigmatize the Latinx community during this response, and they've been careful how to manage as they saw this peak, this curve increasing. So they're now suddenly opening the calls for action, bringing Latinx members of the Latinx community in conversation. We're 3 months late, perhaps, in this, but at least we're here in the idea that at least the contact tracers are now being hired to be Spanish speakers to meet the percent of the population that is being diagnosed with COVID-19. Today we met with Madam Secretary Dr. Mandy Cohen about this with the Latinx community on a phone call. From Latin19 here at Duke, we have invited we have been meeting in our region, but we are inviting Secretary Cohen and others in government to please join us, because we do really need a more what I agree with the caller, well-coordinated response on how to mitigate the problem, stop transmission, and access to care for people suffering from COVID-19. Thank you.
Excellent. Thank you very much for that comprehensive answer. Professor Gonzalez-Guarda, I'd like to come back to you. Another question that we've had come through is asking us whether with the percentage of Latinos infected, does that suggest to you or show to you that reflect the existing social inequality regarding the Latino community in this state?
It absolutely does. I think, in the state, we see that approximately 42% of the cases of COVID-19 are among the Latinx community, while across the state, the community only represents 10%. And here in the Durham area, we see that disparity as well, with only about 14% of our community being Latinx. And in the last month alone, over, almost 70% of the positive cases were among the Latinx community. I think to Viviana's point, where she laid the groundwork to explain what are some of the drivers to this. A key driver here is really the exposure that's innate in the kind of work, the essential work that the Latinx community does. And so we're also seeing disparities that are a result of that, the nature of that work. I think another thing for us to keep an attention on is also the loss of employment in this community. So we're seeing really high rates. We're actually seeing that the Latinx community is the community that has lost the most jobs in this period. So I think that's important for us to know. Para hablar un poco sobre las disparidades sociales y de salud relacionadas con el COVID-19, en el estado de North Carolina, los latinos representan 10% de la población, sin embargo, 42% de la población infectada con COVID-19. Aquí en Durham también vemos esa disparidad. Solamente 14% de la comunidad en Durham es latina, y sin embargo vemos que en el último mes, en el mes de mayo, casi 70% de la población infectada con COVID-19 eran en la comunidad hispana. Es importante también irnos de nuevo al punto que hizo Viviana sobre cómo se expone la comunidad, y la manera primaria es a través del trabajo. Entonces nosotros vemos también que muchos miembros de la comunidad latina también están perdiendo sus trabajos, y eso va a tener implicaciones en el futuro también.
Excellent. Thank you very much for that. And while we're on that topic, there is another question that has come through for you to address, if you don't mind. On a similar topic, that says, with the high rate of infection in the Latinx community and their role as essential workers, what kind of impacts do you anticipate to that workforce in the future?
In regards to their continued exposure, I think, to go back to the recommendations I meant in terms of what we need to do, I think going and thinking about what is the primary driver of infection, and it's people going to work. And so we really need to put our resources in making sure that when people go to work and do the essential jobs that we all need them to do, that they're safe. And part of that safety is not only providing them with masks and the ability to do some physical social distancing in the workplace, but it's also putting pressure to employers to make sure that they are providing paid sick leave for individuals, so that people don't have that pressure of making that decision of whether they need to go to work and potentially expose other people, or to provide support for their families. If we don't address those needs, then it will be very hard to contain disease spread in the workplace. And particularly of concern for us is the construction industry, where we're seeing a lot of the cases here in Durham, meat packing plants, cleaning industry, etc. Para hacer un resumen en español, también yendo al punto de la importancia de dar protecciones para los empleados que están trabajando en los trabajos esenciales. Es muy importante que los empleadores den esas protecciones a los empleados, las máscaras, la habilidad de hacer distancia física y social. Y también es sumamente importante dar apoyo a las personas que están enfermas con pago mientras que están enfermos, para que las personas no tengan esa presión en tener que decidir si van a ir al trabajo y quizá mientras que uno está enfermo y infectar a otros, o tener la habilidad de pagar la renta o hacer otros pagos relacionados con la comida y la familia.
Excellent. Thank you very much for that. And we appreciate the people with hands raised and who are submitting questions. Please do keep those coming, and be patient. We will get to you and we'll get everybody's questions answered. And before we unmute anybody else, there's another question that's come in that I'd like to address to Dr. Maradiaga. Could you talk a little bit about multi-system inflammatory syndrome in children and why that's especially important to know about right now?
Yes, thank you for the question. This is Dr. Gabriela Maradiaga. Multisystemic inflammatory syndrome in children is something we are seeing in children after they have been sick with COVID. So a few weeks later, 2, 3, and 4 weeks later, these children are presenting sick, very, very ill to the health system. And when they are testing positive for COVID, or they have antibodies to COVID. And what we are seeing is basically a disproportionately severe reaction by the body's inflammatory and immune system onto itself after COVID. There has been a lot of talk that this is similar to something we know as Kawasaki. It is similar, but it is not the same. And the body becomes overwhelmed by this inflammatory response, and the systems that keep us functioning break down. Heart, kidney, liver. These children end up needing a lot of support in intensive care units. And thankfully, again, with the appropriate support, if they get to care early, they can make it through the illness. The key important point there is getting to healthcare early. Entonces, estamos hablando del síndrome inflamatorio multisistémico pediátrico. Es un cuadro clínico que se presenta 2, 3 y 4 semanas después de una infección con el COVID-19. No es durante el momento de la enfermedad, sino después. Los niños manifiestan sintomatología muy grave. Están enfermos y presentan al sistema médico bien graves. Lo que estamos entendiendo es que se desencadena una reacción inflamatoria desproporcionada que ataca el cuerpo, se ataca uno mismo y afecta los órganos del cuerpo, el corazón, el hígado, los riñones, los pulmones, y los niños necesitan cuidados intensivos para superar la enfermedad. Sabemos que si los niños llegan a cuidados médicos y reciben los cuidados médicos apropiados, la gran mayoría pueden superar la enfermedad, e irse a casa bien, pero no todos. Y por eso es tan crítico que los niños lleguen al cuidado médico rápidamente para darles sus atenciones médicas.
Excellent. Thank you very much for that. I believe we have a question for Dr. Martinez-Bianchi from Karina Neira, and you should be unmuted so you can ask your question now.
Buenas tardes, gracias, doctora Viviana. Realmente tengo dos preguntas. La primera es que hemos coincidido que los datos sobre los latinos contagiados son importantes para poder saber y tomar políticas direccionadas a los condados donde hay mayor disparidad. ¿Qué pasa? Publicó hace una semana un informe sobre que solo 16 condados de Carolina del Norte tienen de manera pública estos datos. Pudimos lograr que otros 4 condados nos respondieran. Hoy la directora de salud, Mandy Cohen, dijo que esta información dependía mucho de cada condado. ¿Cómo trabajar con ellos para que brinden esta información, doctora? Esa sería mi primera pregunta. Y la segunda tiene que ver con el incremento de casos de jóvenes adultos que están siendo contagiados por COVID-19 y sobre esta población que está ingresando a cuidados intensivos, tomando en cuenta que solo el 17% de las camas están disponibles en esta unidad.
Muchas gracias, Karina, por esta pregunta. Voy a responder primero a lo de los condados que todavía no han reportado la etnicidad de los casos o la demografía de los casos de COVID-19. Yo creo que debemos hacer una campaña de abogacía al respecto, ¿no? De advocacy. Lo vimos nosotros en el condado de Durham, hace 4 semanas cuando se nos llamó a una reunión a varios líderes latinos y se presentaron los datos al grupo Latin 19. Justamente se habló, nosotros como latinos, ¿verdad? Le pedimos al Departamento de Salud que presentaran esos datos. Y como decía antes en otra respuesta, lo que vimos era lo que ellos tenían miedo era que al reportarlo hubiera una repercusión anti-latino, ¿verdad? O anti-hispano. Entonces, yo creo que es muy importante lo que estábamos hablando, ¿no? Tenemos que dirigirnos a esos condados de salud, quizás ahora que estamos reuniéndonos, empezamos a reunirnos con todos los stakeholders, la gente latina del Estado, que hagamos una campaña de cartas a todos los departamentos de salud explicando por qué y quizás cómo debería compartirse esa información, reconociendo realmente la importancia. Yo creo que tenemos que reconocer cuánto los latinos contribuyen a la economía de Carolina del Norte, que es algo que a veces se mantiene en las sombras, ¿no? Porque mucha gente está trabajando por contrato, etcétera. Muchos sabemos la realidad de esto. Pero sí, yo creo que es muy importante que se conozca la información porque la persona informada puede entonces hacer decisiones basadas en la evidencia y no basadas en lo que me parece o no me parece, sino como debe estar. What I was answering to Karina Neira's from Que Pasa was that we really think it is important that all public health departments in the state release the information of ethnicity and all demographics in relationship to Latin-19 cases, that an informed community is able to better prepare and respond to having COVID-19. We did through our experience here in Durham County is that sometimes health departments may be afraid of releasing certain information just to make sure that the rest of the community is not going to act in a negative response against the Hispanic community, but we need to recognize the tremendous economic contributions that the Latinx community, that the Hispanic community is doing for the state of North Carolina. We need to think about that many of these people have been and are essential workers. And so I propose that perhaps through members of the Latinx community, other stakeholders and allies, we should do a campaign of letter writing and advocacy to really share with health departments from the whole state why we think for the Latino community this is important information. La segunda pregunta era el porcentaje de población adulta joven en cuidados intensivos. Hemos tratado de conseguir información en números y todavía no la tenemos. En algún momento alguien dijo 25, 30% de los casos, pero no te puedo decir con exactitud. Lo que sí estoy recibiendo información es que las unidades de terapia intensiva, al menos de nuestro condado, de Durham, tanto en Duke University y en el Regional Hospital, están observando un desproporcionado número de pacientes con COVID-19 y enfermedad crítica que están llegando a la terapia intensiva, jóvenes y de mediana edad. No estamos hablando de que son viejitos, estamos hablando de gente joven entre los 30 y los 50 años que están llegando habiendo esperado demasiado tiempo en la casa, que están quedándose en su casa con síntomas de falta de oxígeno. Entonces, el problema que están viendo en la terapia intensiva es que la gente está llegando, habiendo estado demasiado tiempo con falta de oxígeno, por lo cual, al tiempo en que llegan, no solo tienen el daño de los pulmones, de la hipoxemia, sino daño cardíaco por haber tenido la falta de oxígeno por tanto tiempo, y que ya en ese momento el daño es irreversible. Entonces nos están pidiendo realmente que hagamos una campaña de hacer que la gente llegue antes a hacerse ver a centros respiratorios y a centros de emergencia por la importancia de darles el cuidado necesario lo más pronto posible y no tan tarde. Lo voy a contestar en inglés. We don't have a specific data in numbers, but we do have qualitative data and a response from those who lead intensive care units, at least in our Durham County at Duke Regional and Duke University, that they have seen a disproportionate number of patients with COVID-19 associated critical illness that are Hispanics, both young and middle age. They have never really seen so many people in intensive care unit that spoke Spanish. The other thing is that people are waiting too long to be treated, that they are young and they're staying at home for too long, suffering hypoxemia. And then by the time they present to the emergency room or to the hospital, there is also now added cardiac damage and other damage that is not longer reversible. So they're coming in with irreversible damage and much more difficult to treat. So one of the recommendations that we have for people from intensive care units is to please talk with the Latino community and all communities in general, right? If you're having the chest pain, the severe shortness of breath, the symptoms of hypoxemia, of low oxygen, to try to really access a hospital to get the appropriate care sooner rather than later when it's just no longer anything to do. Thank you.
Gracias.
Excellent. Thank you very much for that question and for the comprehensive answer. Dr. Panayotti, we've had so another question for Dr. Maradiaga, sorry. We've had another question for you from Walter Gomez. So this question originally came in Spanish, and he asks, in the case of children and adolescents, when do you recommend to have a COVID-19 test and when is it not necessary?
Yes, great question. Thank you, Walter. So I will answer in English first. Regarding whether children and adolescents, when they should get tested, because of the rapidly spreading nature of COVID-19 that we are seeing in our Latinx community and in the state in general, the recommendation we are giving, and which Dr. Mandy Cohen and the state has promoted, is that everybody who has a concern or a symptom of any kind, be it a runny nose or a cough, should get tested if they can get access to a test. The recommendations right now are to test liberally. So we are recommending the same thing. If a parent has a child or an adolescent that feels common cold symptoms, we are recommending they get tested, especially because that will help us trace contacts and prevent further spread. It doesn't mean necessarily that the child or the adolescent will become sick. In fact, most of the patients I am seeing have mild to no illness. But once we can identify someone who has COVID-19, we are able to provide contact tracing, education, and health services to all their contacts so they can get appropriate care. So right now we are recommended that anybody with any symptom concerning for COVID-19, which can be respiratory, cough, runny nose, sore throat, GI symptoms, which is new for children. We are seeing a lot of children present with diarrhea, stomach ache, severe abdominal pain. Please reach out to your local health provider and get tested as soon as possible. La pregunta es sobre cuándo se le debe hacer la prueba del COVID-19 a los niños y adolescentes. Lo que estamos viendo ahorita es que por la propagación rápida del COVID-19 en la comunidad latina y en el estado, estamos recomendando, al igual que la doctora Mandy Cohen, secretaria de Salud del Estado, es que se hagan la prueba todas las personas que tienen cualquier sintomatología del COVID-19. Esto puede ser sintomatología que uno pensaba sería un resfriado, algo leve, del cuadro respiratorio, tos, chorreadera de la nariz, dolor de garganta. También estamos viendo en los niños muchos dolores del estómago, diarrea, dolor intenso en el estómago. Cualquier síntoma de ese tipo, estamos recomendando por favor que se haga la prueba. Si usted tiene acceso, puede llamar a su centro de salud, a su médico de cabecera o llamar a las líneas de contacto del estado a ver a dónde se hace la prueba. Entonces, ahora mismo estamos recomendando cualquier niño o adolescente que tiene síntomas o contacto con alguien del COVID, por favor, hágase la prueba. No solo por el cuidado de esa persona, pero porque podemos identificar a esa persona y a sus hermanos, tíos, primos y otros contactos que pueden haberse contagiado con el COVID y ellos pueden presentar más grave. Entonces, en resumen, estamos recomendando, Walter, que todos los niños y jóvenes que puedan, que están teniendo síntomas, por favor, se hagan la prueba.
Excellent. Thank you very much for that. We have another question that I think it's possible that both of you might like to weigh in on, and I'll let whoever wants to take a crack at it first can do that. And it's a question we had that came in advance in Spanish, and it said that obviously there are some large families that are struggling with infection within their family. And what kind of responses or what kind of strategies can you suggest to larger families to prevent transmission from within the household?
Great question. Regarding how to prevent transmission in the household, this is very challenging. I think anybody who lives with any other person knows how much contact one has with each other. And we are recommending a few basic things, but also recognize this can be hard for others. Number one is, if possible, the person who is sick should be isolated in a separate room and a separate bathroom. We want to minimize the exposure of the other people in the household to their secretions and their contacts. Often that's not possible, so we are trying to say, in whatever way you can, minimize contact with that person. Definitely that person should wear a mask, and the other people in the house, including children who are 2 and up, who are near that person, should also wear a mask. Frequent cleaning, hand hygiene, good hand washing, not quick hand washing, good 20 seconds or more hand washing, and being especially careful with anything that touches the mouth. One thing I like to remind folks is that COVID-19 is very scary. At the same time, we know a lot about it. And so we know we get COVID-19 when it touches your mucosal surfaces, so your eye, or it goes in your nose or in your mouth. So if you're very careful about where you put your hands and how you touch this part of your face, you can really do a great job of preventing spread. La pregunta es sobre el contagio del COVID-19 en un hogar. Sabemos que es muy difícil, pues hay muchos contactos dentro de la casa. Para evitar esos contactos puede ser muy difícil. Entonces, si es posible, la persona que está contagiada debería de estar en un cuarto separado con un baño separado. Sabemos que eso no siempre es posible. Entonces, recomendamos a esa persona que se mantenga aparte en lo que se pueda. Definitivamente usar un tapaboca para prevenir el contagio de las secreciones. Y las otras personas en la casa también deberían usar tapaboca, y los niños de 2 años para arriba que puedan también al estar cerca de esa persona. Mucho cuidado con la preparación de la comida y en los baños. Me gusta siempre comentar que el COVID-19, aunque nos espanta mucho y ha causado mucho trastorno, también sabemos mucho de cómo se transmite. El virus se pasa por nuestras superficies en la cara, los ojos, la nariz y la boca. Entonces, si tenemos mucha atención a dónde ponemos las manos y cómo nos tocamos la cara, podemos prevenir. Lavarse siempre las manos y lavárselas bien 20 segundos o más, y tener mucho cuidado con el contacto de las manos y la cara. Viviana, ¿te gustaría agregar algo más? Dr. Viviana, would you like to add anything else?
Sure, yes. Another thing that I was thinking about is to make sure also that when people are isolated, one other thing is to separate the garbage in the house. So if somebody is having to use Kleenexes and things like that, to keep those in a separate garbage can so others may not get contaminated by using that. So el uso también de un cesto de basura con una bolsa solamente para esa persona, quizás al lado de su cama, para que no tampoco se contaminen con el uso de pañuelos y otras cosas de la persona que está enferma. Y la otra cosa que yo creo que es importante recalcar es la importancia de que otros miembros de la familia estén monitoreando a la persona que está enferma. Something else that I think is important to add is that other family members may want to monitor how that person is doing. Y si ven que se pone confuso, que está teniendo más dificultad para respirar, que se están poniendo azulitos el color de los labios y todo eso, que entonces es el momento de que no hay que poderse, ya en ese momento ya no se puede estar en casa, hay que ir a hacerse ver a un centro médico. And the other thing I wanted to add is for other family members, as you are watching the person that may be sick, and that person may be resting in bed, etc. But keep an eye on them. Are they breathing okay? Are they starting to have chest pain? Are they having difficulty breathing? Is their color turning slightly blue? All those things are for other family members too. It's so important to monitor how the sicker members of the family are doing. And in those cases, to please not wait any longer. It's time to go to be seen in a respiratory center or in the emergency room.
Excellent. Thank you both for those responses. We have some more hands raised, including Andrew Joseph. So if we can unmute Andrew, I think you should be ready and able to ask your question now.
Hi, thanks very much. This is Andrew at STAT. So the Latinx and Black communities as well have been disproportionately affected by the pandemic, as you all have been talking about. And I wonder if there's any evidence that changed over the course of the US epidemic. Like, did the disparate rates of infection and mortality change at all between, say, March and June? And similarly, going forward, as some states are now seeing pretty big increases in cases, do you see those disparities continuing? Thanks very much.
One of the things that I have seen, and a big reason why Dr. Maradiaga and I kind of raised the concern that we needed to get together as a Latinx community and started Latin19 back on March 18th, was that we were seeing what was happening in New York, but we had also seen what happened in Spain and Italy, with cultures similar to others, where there is multi-generational family units living together. And in this country in particular, similarities of people living together of different ages, with some of the members of the family being essential workers, going to work and then bringing, getting sick at work and then bringing it home. So I'm not really sure that it has particularly changed. If you look at the state of North Carolina in particular, you will see that it is not surprising that the map shows that areas, counties with more spread of COVID-19 tend to be, especially in rural North Carolina, related to meat packing plants. We today requested from Secretary Mandy Cohen to please, we really think that packing plants need to actually release the information on cases of COVID, because the community needs to be informed. So again, is that link? I don't know that epidemiologically or demographically we can already say that it has changed. We are seeing it spread more widely in the Latinx community, but we also see that the difficulty for isolation is real, and that people have been working 8 to 10 hours a day in work, in job situations where there is no, it's very difficult to isolate also. I don't know if Rosa will have some other information from what you're seeing also from your Ser Hispano project. Muted.
Rosa, I think you're still muted. There we go.
I think an important point here is that disparities, underlying disparities, are contributing to the disparities that we see in COVID-19. They're just unveiling those problems that we see with COVID-19, the same kind of patterns with racial and ethnic minority groups in terms of outcomes as we see with other conditions. It just so happens that this is an emergency situation, and so these patterns are being uncovered in a very drastic way. One of the drivers of the disparities that we saw initially is that with the case of New York and people living in more tightly dense environments, then of course that increased the risk of exposure, and racial and ethnic minority groups are overrepresented in those densely populated urban centers. Of course, we also see it in rural centers here in North Carolina, and as Viviana mentioned, that exposure is related to occupation rather than where you're living.
And going forward, I guess, because it's going to be more people returning to work, not just essential workers, and just more people out and about, going to restaurants, going back to sort of whatever normal life might look like. Do you think those disparities will still continue, or do you think they could, I don't know, even out a little bit?
I think potentially we'll see the emergence of other populations being infected, as well as people start going out and about. I think, unfortunately, though, the consequences that we're going to see from the COVID-19 pandemic are also social consequences. So I mentioned earlier that people are losing, racial and ethnic minority groups are losing jobs more quickly than other groups. And that's going to have a later on consequence. So I suspect that these populations are going to continue to be at high risk.
Thanks very much.
Okay, thank you, Andrew, for that question, and to our panelists for their answers. We'll be wrapping up here in a few minutes, but we have time for a few more questions. And Dr. Maradiaga, I wanted to come back to you for a blanket question that you've addressed somewhat, but it's a chance to re-emphasize or add anything we've missed about things that parents or caregivers should be especially vigilant for in children right now, or anything they should make sure that they're doing.
Yes, very important question. Parents will often ask me, what should they be on the lookout for and what can they do? So I will try to empower parents to know they know their child best. They know what their child acts like, what sets them off, what doesn't. So I will encourage parents to look out for changes in their child's behavior, in their energy, and in their health. And again, if they have any symptoms of being sick, runny nose, sore throat, tummy aches, rash, fever, I encourage them to call their health provider and get tested. And then in terms of getting really sick, look out for fever that doesn't go away in more than 1 day, severe tummy pain, rash, change in mood, change in energy, because those are the signs that things are getting worse. Again, with MIS-C, what we are seeing are children that get sick 3 and 4 weeks after they've had a COVID infection. So this is an out of proportion inflammatory reaction. It is not subtle. These kids will get sick. The parents will know. Unfortunately, what I think is hard are for the children who get sick very quickly during their episode of COVID, because children can get sick and very ill very quickly. So again, it's an emphasis to parents to reach out to their healthcare center if they have any questions or concerns. And the other thing I would encourage parents to do is teach children about hygiene, about washing hands, about wearing face masks, and about making sure to avoid contact with other people and maintain social distance. Con respecto a la pregunta de qué deben hacer los padres para estar pendientes de trastornos en los niños con el COVID-19, me gusta asegurar a los padres que nadie conoce a los hijos mejor que ellos. Entonces, si empiezan a ver cambios en la energía, en el ánimo, en el estado de salud de los niños, por favor, acudan a su centro médico cuando puedan. Si ven gripe, mocos, tos, dolor de estómago, sarpullido, ronchas y fiebres, por favor, si pueden hacerse la prueba, háganse para saber si el niño está enfermo o no. También les recuerdo que el cuadro multisistémico que estamos viendo pasa 3 y 4 semanas después del COVID. Entonces no es pegadito a la enfermedad, es después. Y esos niños están graves. Eso es algo que los padres van a saber, que el niño está bien grave. Sin embargo, lo que estamos viendo en los casos más trágicos son los niños que se enferman rápidamente. Se desencadena un cuadro clínico muy complicado y los niños se enferman gravemente. Entonces, por favor, estén pendientes de cualquier cambio en los niños y acudan a su centro médico si ven algo que se pone más grave. Y también ayuden a los niños a estar pendientes de la higiene, a lavarse las manos y usar tapabocas y mantener la distancia social.
Thank you very much. We are close to an hour now, and so we'll be wrapping up here shortly. But we have one question that was in the Q&A that was directed to Rosa, but I think it's something that all three of you could potentially weigh in on, although we can start with Rosa. And the question says that because the Latinx community is one of the most affected by the infections, what are the concerns about what this might mean for the future of Latinx communities health-wise? What kind of long-term effects, ramifications could we see from being particularly affected by this pandemic?
I see this as, I appreciate the question, and I think it's really important for us to think about how do we address the needs currently of the Latinx community, and what has this taught us that can help us inform the health of the community in the future. And I think one of the things that this has taught us is that we need to be more proactive in thinking about how to get the message out to the Latinx communities in ways that are understandable, not only in terms of language, but also in ways that are relatable culturally and that are from trusted sources. One of the things I've been hearing a lot from my research participants in a study of Latinx immigrants that I have currently ongoing is that people are just fearful. People are fearful of seeking out any help, whether it's information, whether it's testing or it's medical care if they need it. And people are afraid because they're afraid that their immigration status might be compromised. They're afraid about the possibility of having to pay bills, and particularly if they don't have insurance status. And so it's really uncovering some of the structural and fundamental drivers of health in this population. It's going to be critical for us to address as we continue to see a growth in this population in the future. Una de las cosas que creo que es importante de aprender de esta situación es que nos está enseñando lo importante, las cosas importantes que tenemos que hacer ahora para dirigirnos dirigirnos en frente de esta crisis de COVID-19 en la comunidad latina, pero nos enseña también lo que tenemos que hacer en un futuro. Y una de las cosas que estoy aprendiendo de los participantes de mi estudio es que las personas tienen temor de buscar ayuda, de buscar información, tienen temor sobre su situación inmigratoria, si buscan esa ayuda, y también tienen mucho temor sobre cómo van a pagar los biles médicos si reciben algún servicio. Y eso va a ser crítico para nosotros dirigirnos en un futuro para dirigir la salud de la comunidad.
Thank you very much for that answer, Rosa. We've still had questions flooding in, so I'm really going to try and get to as many of these as we can. And one of these, I'll come back to Viviana for this question, if I may, that is asking, what does it mean to be recovered from COVID-19? Are there various criteria, and what do we really mean when we say somebody is recovered?
So to think somebody is recovered is usually we're thinking 14 days, 10 days from the diagnosis plus 3 days of no fever, no cough, no symptoms. We're having the problem of seeing that some employers are asking people to test negative, but we don't really know what the test means. So in general, we're thinking about 10 days, the day of the diagnosis plus 10 days, and then plus 3 days of not having any more cough or respiratory symptoms that reflect that the virus can still be continuously transmitted. In general, we're seeing, like we said before, a lot of mild cases. And then, of course, there are much more severe cases that are lasting a lot longer than those 10 days. But in general, for those who are staying at home, we're seeing that kind of evolution, right? A shorter time. And so we're using that 10 plus 3 days, no cough, 3 days, no fever. So making sure that that people are checking their fever on a daily basis is important if they have COVID-19. Entonces estamos hablando de 10 días en donde ya no haya síntomas, desde el día del diagnóstico más 10 días, más 3 días en donde no haya ya ni fiebre, ni tos, ni otros síntomas respiratorios de transmisión del virus. Por supuesto que vemos gente que también está muy enferma, que está durando muchísimo tiempo en el hospital, pero para los que están dentro de la casa estamos hablando de 10 días de ya no sentirse, desde el día del test, más y luego los 3 días esos de que ya no haya síntomas. Y entonces si la persona tuvo 10 días con fiebre, necesitamos que todavía agregar 3 días más de no tener fiebre, y si todavía tenía tos, entonces 3 días más hasta el momento en que se deje de tener tos. Pero lo mínimo son esos 10 días de aislamiento.
Excellent, thank you very much. We also have a question about what does it mean to be ready for phase 3, and are we in fact ready for phase 3? And Viviana, you can tackle that, or either of our other panelists, feel free to weigh in.
I worry about phase 3 from a physician's perspective, having been taking care of people who have been essential workers who couldn't isolate, to see how much of the spread of disease there is. I know the economy, there's always this argument of economy versus not. I think that only by seeing what happens with all of these we've had people congregate in large groups of people without masks in the recent days. We need to monitor, is this going to be an increase in numbers following those? There have been some calls, including coming from the Department of Health and Human Services, to actually get tested if you're wearing a mask and we're not using a mask. I really think we need to see what happens as groups get together. What are the implications of those? And if we see an outbreak again following those groups, we're going to need to be very careful. Pienso que tenemos que monitorear qué es lo que está ocurriendo a través de estos grupos que se están congregando recientemente, desde el Estado, desde la secretaria Mandicón salió la recomendación de que si uno estuvo en marchas, por ejemplo, o en grupos congregados, se hagan tests. recién vamos a saber qué es lo que pasa a través de cuáles son las consecuencias de estos grupos que se están juntando. Si vemos que la curva empieza a aumentar de nuevo, entonces va a querer decir que no estamos listos todavía para una fase 3. No sé si mis colegas tienen algunos otros, si Rosa o Gabriela, pero...
Terrific, thank you. There are a couple of raised hands still, and we're going to try and race through to get everybody's questions answered. Sylvia Obien, you're now unmuted, so if you have another question, please go ahead. Okay, maybe we lost Sylvia. I'm not sure.
Hola, hola,
No,
hello. Okay.
Yep,
Hola, buenas tardes. Soy Silvia Oben de Telemundo Charlotte. Tengo una pregunta para todos ustedes que son expertos en este tema. Yo solo lo veo cada vez que salgo y me da mucha preocupación porque solamente se está hablando que los hispanos están saliendo por trabajos esenciales, pero yo veo muchos en los supermercados también, amigos míos de 30 años, 40, ayer vi a uno haciendo una fiesta de cumpleaños a su hijo, tienen 10 personas juntas, he visto gimnasios y me consta, tengo fotos que la doctora Viviana ha visto recientemente. ¿Qué mensaje ustedes le tienen para estas personas? Creo que juntos nosotros podemos hacer el poder para que estos números puedan bajar y hacer un ejemplo a este país de que los hispanos sí podemos hacerlo todos juntos, pero a veces piensan que tal vez por trabajar en lugares esenciales tienen derecho a también llevar reuniones familiares.
Silvia, te agradezco mucho la pregunta. Tenemos una responsabilidad muy grande a partir de la comunidad latina de tomar esto muy en serio. No podemos decir que, hemos visto, perdón, casos de brotes que siguieron a fiestas después del Día de la Madre. Me preocupa en este momento las fiestas de graduación que probablemente también van a llevar a mayor cantidad de brotes. Es una cuestión de disciplina, es una cuestión de decir, es un problema serio que se está disparando en la comunidad y que tenemos que tener en cuenta que debemos proteger a nuestras familias, a nuestros abuelos, a nuestras madres y a nuestros niños. No podemos seguir no teniendo la responsabilidad de la importancia de no seguir transmitiendo esto. Yo creo, in English, I'm going to say this, I think there is a real need for responsibility for all of us who are becoming affected, to protect our families, to wear masks, to keep social distance and to keep our families safe. The question, to translate it to English, asked, what should we do as a Latino community? And we need to become responsible to protect the community. We are seeing cases where people bring it from work and take it home to a grandmother, to mother, father, and the children, and then some of those people in the family end up being admitted to the hospital. We have to have the responsibility of wearing masks, of not having large parties. Some of the outbreaks we have seen followed Mother's Day events. As a physician, I am particularly worried about the potential of now graduations and things like that, bringing people together, and then also having more spread from that. So yes, there is a need, Sylvia, as you mentioned, of being more responsible about this so that we don't continue to see members of the Latinx community getting sick, or any community in general, right? This is not a political issue, this is a public health crisis.
Muchas gracias.
Absolutely, and I can't think of a better place to wrap it up there. We've gone over the hour. Thank you so much to our panelists for sharing this essential information with us at a time of such great need. Thanks for all the reporters who joined us on the call. If you'd like to be included on the advisory for future Duke Media briefings, please email us at dukenews@duke.edu. And in the meantime, thank you everybody for your time, and please stay well. Thanks.
Thank you.